to be invited back to the ALF seminars. I previously attended both the San Diego and the St. Louis seminar in the past. So I'm coming to you via video to explain a little bit more about the GEMPro. What the GEMPro does, it's an instrumentation that is used in a dental practice. It records SpO2, heart rate, bruxism, parafunction, snoring, and body position. It is used on both adult and pediatric patients. Moreover, the GEMPro is easy to use. One of the unique features of the GEMPro is we calibrate the bruxism channel. Because the bruxism channel is calibrated, we can comment on both the frequency and magnitude of bruxism. The GEMPro is also a great tool to assess tooth wear and the overall functionality of the airway. I know Dr. Nordstrom likes to perform both a baseline study and a treatment study using the GEMPro to determine the efficacy of the patient's therapy. Finally, in case any of you are doing restorations, the GEMPro can be used to manage overloading risks associated with implants and patients with undiagnosed airway issues. Now, I'd like to introduce Jeff Weiscarver, who will be explaining how the dentist and the patient can efficiently operate the GEMPro. Jeff?
Thanks, Shannon. Today we're going to talk about your patient's experience when you order a GEMPro study for them, and then also the steps they'll be taking at home when they're performing a GEMPro study. Included with the kit is a tablet, which has the app that we'll be using to record the overnight sleep study. Also, there'll be the two sensors, the oximeter and the BioBrooks amplifier. And also there'll be a booklet that you'll want to give to your patient that gives step-by-step instructions on how to record that. When a GEMPro study gets set up for a patient by the doctor, that patient is issued a 4-digit PIN, and that 4-digit PIN is entered by the patient to start their study. The purpose of the PIN is to maintain HIPAA compliance. Once a patient enters their PIN, they'll need to turn on the oximeter, and they'll also need to turn on the BioBrooks amplifier. Once the patient enters their 4-digit PIN and the sensors have been turned on and the tablet is plugged into the wall, the tablet will automatically detect the sensors and prompt the user to take the next step in recording their study. At this point, the tablet is going to prompt the patient to enter whether or not they're going to do a baseline study or if they're performing a therapeutic study, which could include wearing their oral appliance or CPAP or what have you. At this point, your patients receive instructions on how to put the amplifier on their pajamas and locate the masseter to place the Surface EMG pad on. The next step in the process, the tablet will give the patient instructions on how to apply the oximeter, which is essentially putting on a wristwatch type device, and then there's a finger probe, a finger cuff that goes over the tip of the finger. As Shannon mentioned earlier, we do a very unique calibration, and the calibration process allows us to report on bruxism on two vectors, magnitude or strength, and frequency. And so with those two vectors covered, we offer a unique perspective on reporting on parafunction. Once the EMG calibration is completed, the screen will automatically prompt you to perform an audio test, which is simply the tablet is listening to the room, and the purpose of that is to help us do a better job of assessing the patient's snoring. Once the audio calibration is completed, the patient's ready to start the test by simply clicking the Start Test Now button. During acquisition, which is the screen you see here, there is no need to interact with the screen until the study is completed. And also know that during the night, if for any reason you need to get up, just go ahead and get up. And if you go out of range of the Bluetooth sensors, that's fine. When you come back into range, the tablet will be looking for you and will automatically reconnect. In the morning, when the study is completed, the patient, your patient, simply clicks End Test. The tablet will calculate their report, and then if by chance they did connect to Wi-Fi, it will transmit the report via email to you. For most patients, though, the report will be stored on the tablet. When you receive the tablet back, you type in the patient's code, and the tablet will automatically send you the report. Thanks. Before we get started with reports, I wanted to describe what the steps the dentist takes in order to prepare the GEMPro for a study. Each GEMPro user gets assigned a login credential, and it allows them to log into their account. And once logged in, you'll see there's 4 primary options: new patient, find patient, new study, and local studies. Today, for the purpose of this video, we're going to talk about new patient. When you select new patient, a new form will open up and you populate the form with your current patient's demographic information. In addition, we'll be able to assess your patient's tooth wear, both the type of wear and the severity. Additionally, the tablet will generate 2 codes for you, an R code and a T code. The R code is a report only, and T code will allow you to later view the raw data if you choose to. Once you've completed page 1 of the patient demographic form, click register, make a note of the code, and go to page 2. On page 2, you'll fill out a couple more forms, and then you'll want to power up the oximeter by pressing the blue button and the BioBrooks amplifier by flipping the little black switch on the side. Power those 2 sensors up and click each of the 2 scan buttons on the form and make sure that the MAC address appears in the form. And once you're done, go ahead and click the done button and you're ready to go. Okay, Shannon, that wraps things up for me, and I'm going to kind of turn it back over to you and let you talk about reports and finish up. Thanks.
Thanks, Jeff. Now let's take a look at reports. You see the example on the screen here. There's 4 different analyses. There's SpO2 analysis, there's heart rate analysis, bruxism analysis, and audio analysis. Let's look at the SpO2 analysis. What this determines is the oxygen saturations, and it does find the desaturations that do occur in the patient's sleep. The heart rate analysis gives your heart rate variability. The bruxism analysis, it determines the frequency and magnitude from the patient's waking bite force to sleeping bite force. And then the audio, it does determine if there is any snoring along with clenching and grinding that can sometimes be picked up in the audio. If you do take a look as well, there's different colors in each graph. This determines the body position of the patient. Here's another report which demonstrates a great example of airway triggered parafunction. As you can see under the SpO2 analysis, we do have airway issue, and it does line up with the bruxism issue as well. So we know that this is an airway triggered parafunction that is present with this patient on this report. I want to thank all of you today for sharing your time with me at the ALF seminar. I look forward to hearing from those that do have any questions on the GEMPro and would like to get one started in their practice. I hope you have a great day. Thank you.